Living with bipolar disorder can be an overwhelming and challenging experience. The cycling moods, from debilitating lows to exhilarating highs, can disrupt daily life and relationships. Thankfully, there is hope in the form of Lamictal, a groundbreaking anticonvulsant medication that has shown exceptional results in managing mood disorders. Developed specifically for individuals with bipolar disorder, Lamictal has gained significant recognition in the medical community for its effectiveness in stabilizing mood swings and preventing future episodes. Unlike traditional psychiatric medications, Lamictal has a unique mechanism of action that targets the underlying cause of bipolar disorder rather than merely alleviating symptoms. This innovative approach has made Lamictal a game-changer in the treatment of mood disorders. Studies have shown that Lamictal not only reduces the frequency and intensity of manic and depressive episodes but also helps improve overall quality of life. Patients report increased control over their emotions and enhanced mental clarity. The medication has also demonstrated a low risk of side effects, making it a well-tolerated option for long-term use. If you or a loved one is living with bipolar disorder, Lamictal may offer the breakthrough you've been waiting for. Consult your healthcare provider today to explore this revolutionary treatment option and begin your journey toward stability and wellness. Understanding bipolar disorder and mood disorders. Bipolar disorder is a complex mental health condition characterized by extreme shifts in mood, energy levels, and activity levels. Individuals with bipolar disorder experience episodes of mania, characterized by high energy, euphoria, and impulsive behavior, and episodes of depression, marked by feelings of sadness, hopelessness, and a lack of interest in activities once enjoyed. These mood swings can significantly impact daily life, relationships, and overall well-being. Mood disorders, including bipolar disorder, have traditionally been treated with a combination of psychotherapy and psychiatric medications. While these treatment approaches can be effective, they often focus on managing symptoms rather than targeting the underlying cause of the disorder. This is where Lamictal, a breakthrough anticonvulsant medication, comes into play. How Lamictal works in treating bipolar disorder. Lamictal, also known by its generic name lamotrigine, is an anticonvulsant medication that was initially developed to treat epilepsy. However, its unique mechanism of action was found to be beneficial in managing mood disorders, particularly bipolar disorder. Unlike traditional psychiatric medications that primarily focus on altering brain chemicals, Lamictal works by stabilizing the electrical activity in the brain, which is often disrupted in individuals with bipolar disorder. Specifically, Lamictal targets the glutamate receptors in the brain, reducing the excessive release of this neurotransmitter associated with mood swings and episodes of mania and depression. By modulating glutamate activity, Lamictal helps regulate mood and prevent the extreme shifts experienced by individuals with bipolar disorder. This targeted approach sets Lamictal apart from other medications, making it a promising option for those seeking long-term stability and relief from the symptoms of bipolar disorder. Benefits and effectiveness of Lamictal in managing mood disorders. Numerous studies have demonstrated the efficacy of Lamictal in managing mood disorders, particularly bipolar disorder. Clinical trials have shown that Lamictal significantly reduces the frequency and intensity of both depressive and manic episodes. This means that individuals taking Lamictal experience fewer mood swings, allowing them to lead more stable and fulfilling lives. Furthermore, Lamictal has been found to improve overall quality of life for individuals with bipolar disorder. Patients report increased control over their emotions, enhanced mental clarity, and improved functioning in their daily lives. These improvements can have a significant impact on relationships, work, and overall well-being. Another significant benefit of Lamictal is its low risk of side effects. While all medications carry some potential for adverse reactions, Lamictal is generally well tolerated by most individuals. Common side effects, such as rash, headache, and dizziness, are usually mild and temporary. This makes Lamictal a suitable option for long-term use, providing individuals with bipolar disorder a consistent and effective treatment option. Common side effects and risks of Lamictal. As with any medication, Lamictal does come with potential side effects and risks. It is important to be aware of these and discuss them with your healthcare provider before starting treatment. Common side effects of Lamictal may include rash. A small percentage of individuals may experience a rash, ranging from mild to severe. It is essential to monitor any skin changes and report them to your healthcare provider immediately. Headache. Some individuals may experience headaches, particularly during the initial stages of treatment. These headaches are usually temporary and subside as the body adjusts to the medication. Dizziness. Lamictal can cause dizziness, especially when standing up quickly or changing positions. It is important to take precautions and move slowly to prevent falls or accidents. While these side effects are relatively common and generally mild, it is crucial to communicate any concerns or adverse reactions to your healthcare provider. Additionally, Lamictal carries a rare but serious risk of aseptic meningitis, a condition characterized by inflammation of the protective membranes surrounding the brain and spinal cord. Symptoms may include severe headaches, fever, neck stiffness, and sensitivity to light. If you experience any of these symptoms, seek medical attention immediately. Dosage and administration guidelines for Lamictal. Lamictal is available in tablet form and is typically taken once or twice daily. The dosage prescribed will depend on various factors, including the severity of symptoms and individual response to the medication. It is essential to follow your healthcare provider's instructions regarding dosage and administration. Starting Lamictal requires a gradual titration process to minimize the risk of developing a potentially serious rash. This process involves starting with a low dose and gradually increasing it over several weeks. Your healthcare provider will determine the appropriate titration schedule based on your specific needs. It is crucial to adhere to this schedule and not adjust the dosage on your own. If you miss a dose of Lamictal, take it as soon as you remember. However, if it is close to the time for your next dose, skip the missed dose and continue with your regular dosing schedule. Do not double up on doses to make up for a missed one. Lamictal as a monotherapy or adjunctive therapy for bipolar disorder. Lamictal can be used as both a monotherapy, single treatment, or as an adjunctive therapy, in combination with other medications, for bipolar disorder. The choice between these approaches will depend on factors such as the severity of symptoms, the presence of other mental health conditions, and individual response to treatment. For some individuals with less severe symptoms, Lamictal may be prescribed as a monotherapy. In these cases, Lamictal alone is sufficient to stabilize mood and manage bipolar symptoms effectively. However, for individuals with more severe symptoms or those who have not responded adequately to monotherapy, Lamictal can be used as an adjunctive therapy alongside other medications, such as mood stabilizers or antidepressants. The decision to use Lamictal as a monotherapy or adjunctive therapy should be made in consultation with a healthcare provider who can assess your unique situation and tailor the treatment plan accordingly. Regular monitoring and open communication with your healthcare provider are essential to ensure the optimal management of bipolar disorder. Comparing Lamictal to other anticonvulsant medications for mood disorders. Lamictal is not the only anticonvulsant medication used in the treatment of mood disorders. Other medications, such as lithium, valproate, and carbamazepine, are also commonly prescribed for bipolar disorder. Each medication has its own unique mechanism of action and potential side effects. One advantage of Lamictal over some other anticonvulsant medications is its comparatively lower risk of weight gain and metabolic side effects. Weight gain is a common concern among individuals with bipolar disorder, as certain medications can lead to significant changes in appetite and metabolism. Lamictal, however, does not typically cause weight gain, making it a favorable option for individuals who are concerned about this side effect. Additionally, Lamictal has shown efficacy in both the depressive and manic phases of bipolar disorder, while some other anticonvulsant medications may be more effective for specific symptoms. The choice between these medications will depend on the individual's specific needs, medical history, and response to treatment. It is essential to work closely with your healthcare provider to determine the most suitable medication for your unique situation. Lamictal and its off-label uses in treating other psychiatric conditions. While Lamictal is primarily indicated for the treatment of bipolar disorder, it has also shown effectiveness in managing other psychiatric conditions. Off-label use refers to the use of a medication to treat a condition other than the one for which it was initially approved. Lamictal has been studied and used off-label for conditions such as major depressive disorder, borderline personality disorder, and post-traumatic stress disorder, PTSD. In these cases, Lamictal may be prescribed as an adjunctive therapy when other treatment options have proven ineffective. However, it is important to note that off-label use should always be discussed with a healthcare provider who can assess the potential risks and benefits. While Lamictal may show promise in treating other psychiatric conditions, more research is needed to fully understand its effectiveness and safety in these contexts. Conclusion and final thoughts on Lamictal as a breakthrough medication for mood disorders. Living with bipolar disorder can be challenging, but with the breakthrough anticonvulsant medication Lamictal, there is hope for stability and improved quality of life. Lamictal's unique mechanism of action, targeting the underlying causes of bipolar disorder, has made it a game changer in the treatment of mood disorders. Studies have shown that Lamictal effectively reduces the frequency and intensity of manic and depressive episodes, providing individuals with bipolar disorder with greater control over their emotions and enhanced mental clarity. The medication is generally well tolerated, with a low risk of side effects, making it a suitable long-term treatment option. While Lamictal is primarily indicated for bipolar disorder, it may also have off-label uses in other psychiatric conditions. However, it is important to discuss these options with a healthcare provider to assess the potential risks and benefits. If you or a loved one is living with bipolar disorder, Lamictal may offer the breakthrough you've been waiting for. Consult your healthcare provider today to explore this revolutionary treatment option and begin your journey towards stability and wellness.